Welcome back. We're discussing healing lasers. All right, Dr. We've talked about a lot. We saw the interview. I kind of promised I wasn't going to put you on the spot, but during the break we talked a bit, and I asked you, why do you think everybody isn't using this laser? Because half of what you've told me is unbelievable, but I have to believe you because it happens in your practice every day. Dr. Feld said, happens in his practice every day. People love it. People want it. It gets people, you don't have to give them as much medicine. You don't have to, you talk to me about an impacted wisdom tooth, helping with that. Why isn't this in everybody's practice? Do you think it's because the public doesn't know and isn't demanding it? Do you think it's so new that it scares people? What do you think?
Well, I think first of all, the word isn't out about this technology yet. So I think we need to get the word out to the public and to other health practitioners, whoever they are, about information about this laser.
Not to put you on the spot, but in the 2 years that you've used this, and obviously in 2 years you've used it on hundreds, if not thousands of people, what problems, if any, have you had?
No problems.
Nothing.
In terms of using the laser, in terms of complications,
right.
side effects,
yeah,
zero. No problems.
And you use it, does it help stimulate the bone if you do implants? Does it help, I mean, what is?
Well, it's a multifactorial thing, Mike. First of all, it's going to stimulate fibroblasts, which are the skin cells.
Right.
So skin's going to heal better. In my opinion, it stimulates the osteoblasts. In fact, research shows that it stimulates the osteoblasts. So if you cut a bone, you do an osteotomy on a jaw, you put a dental implant in, or you take out a wisdom tooth, it's going to allow that bone to heal quicker. I mean, how many people ever heard of dry sockets? Dry socket is an event where you take out a tooth, the blood clot falls out early, and there's pain. Well, in my practice, it's very rare to see a dry socket, but if somebody sends me a patient where another practitioner got a dry socket, and I use that laser on it, 5 to 10 minutes, that pain is gone. That area is treated, and that's the beauty of this laser.
All right, you mentioned to me during the break, and that's when I get my best information, you mentioned to me you had somebody come in that had heart problems or had some other issues that was in extreme pain.
Yes.
Really couldn't take much medication.
Right.
You almost forgot you had the laser. Tell me a little bit what.
Well, the gentleman had heart disease. Long story short, he has an abscess tooth in his upper jaw, and I couldn't take it out that day because he's a medical risk. He had a heart attack recently. He has stents in his heart. It's not safe to do them in the office. So how do we treat this guy? Tradition tells us that we look at a patient, take an X-ray, put him on an antibiotic, give him a pain pill, and walk him out the door and schedule him 1 to 2 weeks from now for the surgery. Well, as I was walking him out the door, I realized that I had the laser. I said, "Come on back to this room and let me put this on your tooth for 6 minutes." I basically said, I sat him down, I put it on the tooth for 6 minutes, and it was unbelievable. His pain went completely away. He walked out the door, he was completely comfortable. Of course, we still put him on the antibiotics, gave him the pain medication.
With that said, will it help that area where you treat? If you give the man antibiotics, will the fact that the cells are now actively producing energy or are alive and active, will it help them use the antibiotic to fight the infection?
Yes, it'll actually enhance the effects of the antibiotic.
So it will actually make the antibiotic work faster?
Yes, it will. Yes,
okay.
It will. And it'll actually, and perhaps in a certain sort of way, cut down on the amount of pain medication he takes, and perhaps cut down on any anti-inflammatories he might have to take, and avoid maybe the side effects of those drugs.
All right, I have one more clip of a doctor interviewed. I want you to watch again and tell me. They all are starting to sound, you sound the same, Dr. Feld. This is Dr. Alano out of Los Angeles. It's starting to me to be a repeating message here, so let's take a look at Dr. Alano.
I use the laser a lot for treating my TMJ patients. A lot of our TMJ patients are chronic pain patients, and they have a lot of inflammation, and we're able to use the Luminex very effectively in reducing inflammation and pain in the jaw joints and muscle trigger points, referred pain and muscles as well. I've seen it here in our dental practice since we're a group practice in post-surgeries and reducing post-operative pain and complications. And so it's really done a wonderful job in terms of helping our patients without the use of not having to use a lot of medications such as drugs and anti-inflammatories and such. We don't, it's minimal for those patients. So our patients love it, and it's so easy to use. It's my assistants are the one that administer the laser, so it's great. I had a patient come in last week. She was in the emergency room with so much pain. The morphine didn't work for her. She came in, it was her jaw joints were just so lit up, and so I think this happened on a Saturday, and it was a Saturday that I wasn't here, and so I was able to, over the phone, tell my assistant that I wasn't usually, the one I didn't work with usually, how to use it to apply to that patient, and she walked out of here happy. No shots, no drugs, what's not to like? So it's very helpful. You know, the patients love it. You know, it's a cold laser. It's very non-invasive. It's a great practice builder in terms of our patient are asking about it, and so we're actually able to have patients referred because of it. And so it's great all around. I can't say enough about it. I banged up my knee. There was I could have sprained it trying to, you know, wrestle with my kids, or a little, you know, trying to do some basketball moves like I did in college, but I'm not in college. And either way, that was able to help reduce that pain, because, you know, I wanted to try it on myself to see that, you know, what I could prescribe to my patients, and it really does work. I mean, you know, you could hear it secondhand, but to have it work for you, that's, you know, that's all you really need.
All right, I'm starting to notice, and everyone, like I said, it's a repeating pattern. Everybody I've talked to, they all use it on themselves. They all use it on their friends. Some of the things you told me during the last break we can't really talk about, but you've even said that you've had a chiropractor that you were personally going to use it on you and use it on his staff with incredible results.
Absolutely.
So this is made by USA Laser.
Yes.
It's called the Lumex. If I want to, can I go in and just ask my doctor if he has it and demand to have it used? I mean, how do I find somebody that has this laser to see if it can help me?
Well, hopefully your doctor will have it, and if your doctor doesn't have it, you might ask why he doesn't have it.
To me, and again, I may be way off base here, but if you're a doctor and you mentioned to me that you had shown somebody, he didn't get the laser, the doctor you showed, he knew how it worked, but if you're a doctor and you know of it, you've seen it, experienced it, whether there's a million reports out on it or not, if you don't have it and you're not providing it to your patients and you know about it, to me, you wouldn't be providing the best care possible. Is that safe to say? Is that a fair statement?
Yes, it is. That's safe to say.
Now, you told me in your practice you do TMJ.
Yes.
And you told me with the TMJ you did surgery for a while.
Yes.
And you use the laser now?
Yes, I do. I believe that this laser has cut my TMJ surgery back by about 80 to 90%. In other words, this technology will help to avoid surgery. And being a physician, I only practice in the TMJ world, but I've also been able to help treat carpal tunnel, plantar fasciitis, sciatic back pain, to the point where these patients have not needed surgical procedures.
All with this laser?
Yes.
No side effects so far?
No side effects.
2 years?
No side
100
effects.
people, 1,000 people? How many of you put the laser on?
Hundreds.
And nothing?
Nothing.
Put it on good skin, you're fine?
That's it.
Put on bad skin, it helps it get better?
Yes.
And you use it in your facial surgeries, you use it in your jaw surgeries, you use it in everything?
Use everything.
Well, I want to thank you for coming in. This has been, you know, I tell you, I interview people all over the, this is probably one of the most revolutionary things I've ever seen. So again, thank you for coming in.
Thank you.
You've been watching Medical News Network. I'm Mike Wittgenstein. For further information on this subject or any other, please visit our website at medicalnewsnetwork.info. Until next time, I wish you good health.